Hello. For those of you who I haven't had the opportunity to meet yet, I'm Lindsay Bryan, and I am the new Health and Wellness Manager here at St. Christopher Fund. I wanted to reach out and ask to borrow just a few minutes of your day. One of the most important things of the health and wellness programs is not actually the programs themselves. I'll let you in on a little secret. It's about sharing these programs with others so that we can get more people involved and more people participating in them. And so part of that responsibility is being able to speak amazing things about these programs. And so I wanted to take a few minutes to share with you some of the amazing things that are coming out of the Driven to Be Healthy umbrella program that encompasses all of our health and wellness programs, and to make sure that you feel comfortable and confident being able to speak about these programs whenever you have the opportunity to do so. So, just to give you a quick visual of how our programs are growing, we've got the Driven to Be Healthy umbrella program that we are using now. And then we have some of the many programs that you probably know and love and new ones to go along with it. So one of the newest ones that we have that is well underway, and we're getting a good start to it, is the GPS program, the Get Preventative Screenings program, which is dealing with preventative cancer screenings. And so the one that we are currently offering is prostate cancer screening. It is available for men ages 50 to 69. And we do make exceptions if there's a close family history, because of course that means there's an increased risk and we want to make sure that those people are covered. The screening is very easy to do. They register for our program. I refer them to the next step, which is a very simple process. And then they get their kit mailed directly to them. They can do this kit at home, in their truck, or even in a lab of their choice if they would like to. And they mail it off and they get those results in just a couple of weeks. Now, if they were to get positive results back, Call on Doc helps to connect them with resources to help support them in the next steps. And we also have additional resources available. As we are building this program, we have a couple of others that we hope to be seeing in the near future, and that is cervical and colorectal cancer screenings. We also are in very early discussion of the shared decision-making process for lung cancer screenings, and so I'll have more information on that here in the near future. The next one that has been around for quite some time and is still going strong is the vaccination voucher program. We offer flu, shingles, and pneumonia vaccines for use at Walgreens, Kroger, and the Kroger family of pharmacies, or the Little Clinic. So they have many options while they are out on the road or when they're returning back home. These are available to uninsured drivers or any drivers whose insurance does not cover these vaccinations. We have also made an update this year due to new guidelines in pneumonia vaccines. We're actually reverting to the Prevnar 20 vaccine, which is the highest recommended one for the best protection. And so we're now offering that one. Two of our newest programs that I'm really excited to tell you about. We are halfway through our second round of these, and they have been very successful so far. So the Healthy Habits for the Long Haul in the revamped version of the Diabetes Prevention Program. These are 12-week virtual interactive classes. So they meet with me on Zoom at a time that is convenient for them in a small group setting. We cover topics like nutrition label reading, exercise, stress management, sleep, hydration, and so much more in that 12 weeks. It's a lot of information crammed into one. As part of the program, our participants receive an assortment of tools to help support them in their health and wellness journey. So things like a glucose monitor, a blood pressure cuff, a tape measure to be able to get body measurements, a scale, and some other items as well. And they can join at any time. So even though it's a 12-week program and there's a week 1 and a week 12, I have it planned so that somebody can jump in at any time and still pick up just fine without feeling like they're a mile behind everybody else. Now, the difference between these two programs is the chronic conditions that we are focused on. So diabetes prevention, as the name states, is focused on preventing diabetes. However, the CDC course that we did previously would have eliminated somebody if they were already diagnosed with diabetes. So in making this change, we are actually opening up the number of people that we can assist. I would be happy to have them if they were already diagnosed with diabetes, and we could still make a difference there. With healthy habits for the long haul, we are focused more so on preventing or managing chronic conditions. So this could include things like heart disease, high blood pressure, high cholesterol. I have had participants who have had a stroke within the last year. I had one who had kidney stones. And so we can make certain dietary recommendations based on their condition that help them to reduce the risk for future health conditions or helping to manage the condition that they already have. And so, like I said, these groups have been very successful. Now, what happens when they complete these programs, they get a certificate of achievement. They have put in a lot of work to our Driven to Be Healthy program, and I send them a certificate. And then I also offer them to transition into our long-running diabetes prevention program that uses the CDC year-long course. And so we have a growing number of people who have been in that program for several years now and are continuing to participate. And we cover all sorts of topics on health and wellness, sometimes even ones that they ask if we can cover along the way. So it's very cool, very positive learning environment, and we're seeing so much success from it. The last one that I wanted to share a little bit about, you probably already know about our Rigs Without Cigs program. It's a tobacco cessation program. We offer the full package of treatment options, ongoing support and education, and individual counseling sessions, and also incentive prizes to help provide that little bit of extra motivation along the way. And what's interesting, I just recently completed the MD Anderson Center's Tobacco Treatment Specialist certification. And I was already pretty proud of our success rate, which is typically about 43%. The MD Anderson success rate is 45% when we compare apples to apples. And so while our success rate is really good, I'm on a mission to get us up to that 45% or higher. And so one of the things that I have been looking at is some of the comments that our participants make as to when they feel like they've really hit important milestones in their journey to tobacco cessation. And that doesn't always mean that they have quit. Sometimes it's that aha moment of why they need to quit, or they have transitioned from not quite being ready to I'm definitely ready now. So those are important milestones as well. And one of the things that I hear most often, and I think this is true of all of our programs, is that they say, I'm treated as a person and not as a number. And so when I'm reaching out to any of the participants, this is not participant 207. This is Mr. E, who decided to join the program because he lost a grandchild to suicide, and it made him really rethink how he was living his life. Or this is Mrs. C, who was insistent she was not going to be able to quit smoking because tobacco smoking helped her to manage her anxiety and a chronic pain condition. And yet here she is coming up on her 6-month milestone, and she gets to share with me more exciting things in her life now, like how her garden is doing and how she's using that as a new coping mechanism for stress instead of the tobacco. And so I can say from the bottom of my heart, I really enjoy getting to know these people on a more personal level and making sure the experience that they get within our programs helps to meet their needs. And so I look at each one of them as an individual as far as coming up with their treatment plan and their counseling programs and the education that we talk through, and throwing out ideas of how we're going to do this different and make sure that it's successful this time. And so I hope that that's the part that you will take away when you're sharing these programs, of the love and compassion and care that is behind these programs that helps to make them so successful. And so thank you for letting me borrow just a few minutes of your day to share more about these programs. And I appreciate all that you do to help support us in what we're able to do to help over-the-road drivers.